Welcome to the Involvement Report, brought to you by the Heritage Area Agency on Aging and Kirkwood Community College. My name is Ingrid Wenzel. The Involvement Report brings you news and information for seniors, people with disabilities, and their families in our community. This month, we are going to learn about a very sad and very real reality in our community, elder abuse. Hear more about a study conducted by the Linn County ARP chapter that focuses on livable community issues and older adult residents in Linn County, and talk to Master Gardener Becky Lynch. I'm joined by Tracy Robertson from the Heritage Area Agency on Aging, who's going to talk with me about a sad reality in our community, elder abuse. Hello, Tracy.
Hi, thanks for having me.
Yeah, I want to, you did mention to me there are some graphic photos you'll be sharing, so I just wanted our audience to be aware of that, so thank you.
That's correct, sure.
You have a lot of information to share, and it's important information. And I guess we should really start with what's the prevalence of elder abuse, and who are the victims and who are the typical perpetrators?
Sure. It's really hard to assess the extent of elder abuse that occurs in the community because it's vastly unrecognized and vastly underreported. We know that about 80% of all cases of elder abuse go unreported, and about 40% of those cases involve financial exploitation. Elder abuse can also drastically shorten the life of a person who experiences the abuse.
And the typical victim is?
Typically is a female, which accounts for about 70% of all cases. The average age is 78 years old. Oftentimes they are dependent adults, and we'll talk about that in a few minutes. And neglect is the most common type of abuse.
Okay, and the perpetrators here, it looks like adult children.
Right, really just family members and those friends that have access and are close to the person, unfortunately.
So why do you think, what is the difference between elder abuse and dependent adult abuse?
Elder abuse involves the abuse, neglect, and exploitation of a person aged 60 years and older. Dependent adult abuse, according to the Iowa Code, involves an adult who is age 18 or older, involves a caretaker, and also meets the criteria for the different types of abuse that we'll talk about.
Well, I jumped ahead a little bit, and I'm sorry. Can you talk to us a little bit about, why do victims of abuse, do not report? Why victims of abuse do not let people know that they are being exploited or harmed?
Sure, there's a lot of reasons why the victims don't tell somebody. They may lack self-confidence. They may be afraid of the abuser. They may have reported it in the past, but the abuse escalated after that. They may believe that it's a family matter, it should stay in the family. They may be ashamed, embarrassed, may have been threatened that they'll have to go to a nursing facility if they report the abuse, or other items withheld from them if they report it. So
what is the difference between then elder abuse and dependent adult abuse?
Well, according to the Iowa Code, dependent adult abuse means it's a person age 18 years or older who is unable to protect their own interests or unable to adequately perform or obtain services necessary to meet essential human needs. It could be the result of a physical or mental condition that requires assistance from another. And according to the Iowa Code, a caretaker is a related or non-related person who has the responsibility for the protection, care, or custody of a dependent adult. And this is as a result of assuming the responsibility voluntarily, by contract, through employment, or by order of the court.
Okay, now there are different types of dependent adult abuse under the Iowa Code. Can you walk us through that a little bit?
Correct. There are 6 types of abuse: the physical abuse, sexual exploitation, financial exploitation, denial of critical care by a caregiver, and self-denial of critical care.
What are some of the physical abuse indicators?
Physical abuse indicators can be injuries that have not been cared for properly, any injury incompatible with what the victim is saying had happened, pain upon touch, cuts, lacerations, puncture wounds, dehydration or malnourishment, weight loss, extreme paleness, sunken eyes or cheeks, eye problems such as retinal detachment, poor skin hygiene, absence of hair or hemorrhaging below the scalp, soiled clothing or bed, burns, locked in a room against their will, lack of bandages for injuries, or evidence of unset bones if there was a fracture. And they could be heavily medicated as well, and really disturbing photos here.
You also have some indicators of sexual abuse. Can you walk through some of
Sure.
those for us?
The person's behavior drastically changes from what it was before the abuse. They could be angry, lashing out, very depressed, or symptoms of other mental health issues, may act afraid in the presence of the caretaker, may not want to be left alone with the caretaker. There could be genital or anal bruises or bleeding, swelling or redness in the genital areas, venereal disease.
You also, financial exploitation, unfortunately, is also a sad reality of elder abuse. Can you talk to us a little bit about some indicators of financial
Sure.
exploitation?
According to the Iowa Code, financial exploitation is the act or the process of taking unfair advantage of a dependent adult or the adult's physical or financial resources for one's own personal or financial profit. It's without the informed consent of the dependent adult and may include theft by the use of undue influence, harassment, duress, deception, false representation, or false pretenses. And some examples, things to look for is disparity between income and assets and their lifestyle or living arrangements, unpaid bills when resources should be adequate, signatures on checks that don't match the older adult's, stealing an older adult's Social Security or pension checks, unusual activity in their bank account, coercion into signing or changing legal documents, and then the taking or misusing of their property, food, stamps, medications.
Okay, and I think most folks understand the physical abuse, the sexual abuse, and the financial exploitation, but they may not be as aware of what denial of critical care or self-neglect is. So I
Sure.
appreciate your willingness to share a little bit about this too.
Sure. The denial of critical care is the deprivation of the minimum food, shelter, clothing, supervision, physical or mental health care, or other necessary cares to maintain the dependent adult's life and health. And this is as a result of the willful or negligent acts or omissions of a caretaker.
Okay, and some indicators of the denial of critical care would be
Withholding care, medication, food, liquids, assistance with hygiene and grooming, or withholding physical aids such as eyeglasses, hearing aids, dentures. Providing a lack of clothing that would adequately protect them from extreme weather conditions, lack of heat, living in unsanitary or hazardous conditions, failure to follow through with medical treatments as recommended by a healthcare professional, and leaving a dependent adult alone if they're incapable of self-supervision.
okay. And in the next piece, we're going to talk about denial of critical care, what we refer to as self-neglect.
Right, and it's the same as denial of critical care, but it's as a result of the act or omission by the older adult themselves.
So this individual may have dementia, or they may have
Quite
another
often.
form of dementia, like Alzheimer's disease.
Correct.
Okay.
Correct. And so these folks, they will not provide, adequate food, shelter, clothing for themselves. May intentionally inflict abuse upon themselves, physical abuse. May have suicidal statements, refusal of medical treatments or medications, and this refusal is not based on religious beliefs. Refusal of services that might help alleviate their situation, refusal of visitors, and a lot of denial that there's a problem at all. More specifically, unable to prepare meals for themselves or obtain groceries, unable to care for themselves as far as dressing, bathing, grooming, toileting. They may be confused or unable to understand their living conditions, especially, as you mentioned, if they have some type of dementia. There may be holes in the floors or the walls or through the roof, so they don't have adequate heat during the winter. And the home, could be very cluttered, where they cannot even make it to their stove to cook a meal or to the bathroom to use the toilet, or there's garbage all over their house, which can provide health hazards.
Well, I know that you and have a wonderful team that works in our community to try to intervene and prevent elder abuse. So I'd like you to talk a little bit about what you coordinate, the Iowa Elder Abuse Initiative.
Sure. The Iowa Elder Abuse Initiative focuses on the prevention, intervention, detection, and reporting of elder abuse, neglect, and exploitation by presenting elders with choices to enhance their lifestyle.
And why do you believe the Elder Abuse Initiative is needed?
It's really needed to assist those at risk or abused Iowans who are age 60 and older who do not meet the criteria to be assisted under Iowa's dependent adult abuse laws.
Okay, and the program is funded.
It is funded through the Iowa Department on Aging. We receive a grant, and unfortunately there was a 19% funding cut for this fiscal year. We currently have the Elder Abuse Initiative as a service in Lynn, Johnson, Cedar, and Jones counties. And unfortunately, as a result of the cuts, we did have to reduce our service territory within the Heritage region. But we do look at cases on a case-by-case basis in some of the other counties that is served by Heritage. And then I'll talk a little bit about reporting.
Yes, and I think that's the real critical part, because I think some people may know there's an issue, but they just don't know where to go and what to do.
Sure. If abuse is suspected in the community, a person should contact the Department of Human Services, and that phone number is 1-800-362-2178. And law enforcement as well in all cases of abuse except the self-denial of critical care.
And if it's an abuse that's suspected in a facility, or let's say a program that supports older adults?
Then the Department of Inspections and Appeals should be contacted. And that phone number is 1-877-686-0027. And we do encourage calls to the Elder Abuse Initiative as well regarding any person age 60 and older who are or have been abused or at risk and who do not live in a licensed facility.
Well, talk to us a little bit about imminent risk. Some people know, should I call now? Should I get more information before I call in?
If a person needs immediate intervention, then a person should call 911 immediately. If a person is a mandatory reporter as a result of their profession, then they need to
contact DHS.
DHS, and according to the mandatory reporting guidelines.
Okay. Well, I know that you are wanting and willing to talk to people who have questions about this critical issue. We have the numbers on the screen right now, but if you could just give us one number that folks could give us a call at, or give you a call at, rather.
Sure. Call me at area code 319-398-5559, and I can answer any questions about the Elder Abuse Initiative and whether that's an appropriate referral.
Okay, well, it takes a very special person to be able to work with this difficult issue, and I know you have wonderful colleagues that work with you to address the needs of our community. Thank you.
You're very welcome. Thank you.
Stay tuned to learn about the Lynn County AARP Livable Communities Survey.
The emerald ash borer beetle has destroyed millions of trees.
It lives in firewood.
When you move firewood, you spread the beetle.
Learn more at stopthebeetle.info.
And promise you won't move firewood.
Judy Fries from the Lynn County chapter of AARP is here to tell us about part of a comprehensive study the chapter conducted that focused on livable communities and older adult residents in Lynn County. Welcome, Judy.
Thank you.
What do you mean by livable communities?
Livable community is about being able to stay in your home as long as possible.
Okay, and I know you have a lot of information to share, so we're going to just go ahead and get started, and you share us a little background and tell us about the survey component you're going to share
Okay.
information with.
Okay, thank you. AARP, in conjunction with community partners, conducted a survey during the summer of 2009,